So, you may have heard about different types of antidepressants like SSRIs, SNRIs, and MAOIs, but do you really know how they work? The truth is, even experts aren't completely sure how these drugs help. There's just a lot we don't know about how the brain functions. But the most important thing for you to know is that antidepressants often can help with treatment-resistant depression. To help you understand all your medication options, let's go over the facts about different types of antidepressants and some tips on how to use them most effectively. When it comes to antidepressants, it's often simplified as just fixing a chemical imbalance or a serotonin deficiency. But the truth is, we still don't fully understand what causes depression or how antidepressants actually work. However, many researchers believe that antidepressants work by affecting certain brain circuits and the chemicals, called neurotransmitters, that pass signals between nerve cells in the brain. These chemicals include serotonin, dopamine, and norepinephrine, and different types of antidepressants seem to affect how these neurotransmitters behave. Let's take a look at the main types of antidepressants and how they work. Reuptake inhibitors are a common type of antidepressants that work by preventing neurotransmitters from being reabsorbed back into nerve cells in the brain. This helps to keep the levels of neurotransmitters higher, improving communication between nerve cells and strengthening circuits in the brain that regulate mood. There are three types of reuptake inhibitors that target different neurotransmitters. Selective serotonin reuptake inhibitors, SSRIs, are some of the most commonly prescribed antidepressants. They include drugs like Prozac, Zoloft, and Paxil, and are used to treat depression and other mood disorders. Serotonin and norepinephrine reuptake inhibitors, SNRIs, block the reuptake of both serotonin and norepinephrine. Drugs like Cymbalta and Effexor fall into this category and are used to treat depression, anxiety, and other conditions. Norepinephrine and dopamine reuptake inhibitors, NDRIs, are represented by only one drug, Wellbutrin, which affects the reuptake of norepinephrine and dopamine. Wellbutrin is used to treat depression and help with smoking cessation. Tetracyclics, such as amoxapine, maproteline, and mirtazapine, work by stopping neurotransmitters from binding with specific receptors on the nerves. This causes norepinephrine and serotonin to build up between the nerve cells, leading to a rise in neurotransmitter levels. Serotonin antagonist and reuptake inhibitors, SARIs, like nifazodone and trazodone, prevent the reuptake of serotonin and redirect serotonin particles to other receptors that can help nerve cells within mood circuits function better. Tricyclic antidepressants, or TCAs, and monoamine oxidase inhibitors, or MAOIs, were some of the first drugs used to treat depression. They can be effective, but they also have serious side effects and can be dangerous if taken in large amounts. These days, doctors usually only prescribe them if other newer and better tolerated medications have not been helpful. TCAs and MAOIs might not be the best choice for someone who has just been diagnosed with depression, but they can sometimes be very helpful for people with treatment-resistant depression or certain forms of depression, like depression with anxiety. TCAs, such as amitriptyline, desipramine, imipramine, and nortriptyline, work by blocking the reabsorption of serotonin and epinephrine back into nerve cells, while MAOIs, such as selegiline, isocarboxazid, phenelzyne, and tranylcypromine, work by blocking an enzyme that breaks down neurotransmitters in the brain. However, both types of medications have potential side effects and can interact with other medications and foods, so they require close monitoring by a doctor. There are also nutraceuticals or medical food like L-methylfolate, which is a prescription-strength form of folate. Low levels of folate can affect the neurotransmitters that control moods, and L-methylfolate has been proven to be effective in stimulating the production of neurotransmitters. The way antidepressants work is still not fully understood. We're not sure if low levels of certain chemicals in the brain cause depression, or if raising those levels resolves it. It's also possible that antidepressants have effects we don't know about yet, and that their benefits may not be solely related to neurotransmitter levels. But despite not having all the answers, we do know that antidepressants can help many people feel better. Research has shown that they can be effective in treating depression, even treatment-resistant depression. It's important to be patient when taking an antidepressant, as they can take weeks or months to have their full effect. Unlike drinking coffee or alcohol, the effects of antidepressants are not instant, so it's important to adjust your expectations and give them time to work.